Genital herpes is a common sexually transmitted infection, or STI. It's important to learn about genital herpes. Understanding the facts can help us stay healthy. We can also reduce the stigma surrounding this infection. Many people have genital herpes, but not everyone knows it. This is because symptoms can be mild or even absent. Open conversations about STIs are crucial. By increasing awareness, we empower ourselves. We can make informed decisions about our sexual health. We can also support those living with genital herpes. Genital herpes is caused by the herpes simplex virus, or HSV. This virus is highly contagious and can be transmitted through direct contact with an infected person. It is important to understand how this virus operates and the different forms it can take. There are two main types of herpes, simplex virus, HSV1 and HSV2. Each type has its own characteristics and preferred sites of infection, although there can be some overlap. HSV1 usually causes oral herpes, which manifests as cold sores or fever blisters around the mouth and on the lips. These sores can be painful and may recur periodically, especially during times of stress or illness. HSV2, on the other hand, is the primary cause of genital herpes. This type of herpes results in sores and blisters in the genital and anal areas, which can be quite uncomfortable and distressing for those affected. However, it is important to note that both HSV1 and HSV2 can infect the genital area. This means that oral herpes can be transmitted to the genitals through oral sex, and vice versa. This transmission through oral sex highlights the importance of understanding how herpes can spread. Safe sexual practices and open communication with partners are crucial in managing the risk of transmission. HSV is a sneaky virus. It has the ability to evade the immune system and can remain dormant in the body for long periods. This dormancy can make it difficult to detect and treat effectively. It can live in the body for years without causing symptoms. During this time, the virus hides in nerve cells and can reactivate later, leading to outbreaks of sores and blisters. This means a person can have herpes and not know it. Asymptomatic carriers can still spread the virus to others, making it a silent but persistent threat. They can still transmit the virus to others, even if they do not have visible symptoms. This underscores the importance of regular medical checkups and honest discussions about sexual health with partners. Understanding the different types of HSV is important. Knowledge about the virus helps individuals take appropriate precautions and seek timely medical advice. It helps healthcare providers make accurate diagnoses. By identifying whether an infection is caused by HSV1 or HSV2, doctors can tailor their treatment plans to better address the specific needs of the patient. It also guides treatment decisions. Effective management of herpes involves antiviral medications, lifestyle adjustments, and sometimes counseling to help patients cope with the emotional impact of the diagnosis. Genital herpes symptoms vary widely from person to person. Some people have no symptoms at all, making it difficult to know they are infected. Others may experience mild outbreaks that can be easily mistaken for other skin conditions. On the other hand, some individuals suffer from more severe outbreaks. These can be quite painful and distressing, significantly impacting daily life. The first outbreak is often the most intense and can include a range of symptoms. This initial episode can last longer and be more painful than subsequent outbreaks. Flu-like symptoms such as fever, swollen glands, and body aches can accompany the first outbreak. These systemic symptoms can make the initial episode particularly challenging. Painful blisters or sores on the genitals are common during an outbreak. These blisters can break open and become ulcers, which can be very uncomfortable. Recurrent outbreaks tend to be milder and shorter in duration compared to the first outbreak. However, they can still cause significant discomfort. Over time, the frequency of outbreaks usually decreases. Many people find that their outbreaks become less frequent and less severe as the years go by. Early symptoms of an outbreak can include tingling, itching, or a burning sensation in the genital area. Small blisters may appear, which can be a sign that an outbreak is starting. It's important to note that symptoms can be different for everyone. Some people may have very mild symptoms or none at all, while others may have more severe and frequent outbreaks. Any unusual sores, discomfort, or other symptoms in the genital area should be checked by a doctor. Early diagnosis and treatment can help manage symptoms and reduce the risk of transmission to others. Genital herpes is spread through skin-to-skin contact. This usually happens during sexual activity. You can get herpes from someone who doesn't have visible sores. You can't get herpes from toilet seats, towels, or swimming pools. The virus can't survive outside the body for long. Knowing how herpes is transmitted is crucial for prevention. It helps dispel myths and misconceptions. Accurate information empowers individuals. They can make responsible choices about their sexual health. Managing genital herpes involves understanding that, unfortunately, there is no cure for the virus. This can be a difficult reality to accept, but it's important to remember that having herpes is more common than many people realize. Millions of people around the world live with this condition, and with the right approach, it can be managed effectively. However, antiviral medications can be quite effective in managing it. These medications, such as acyclovir, valacyclovir, and famciclovir, work by inhibiting the virus's ability to replicate. This means that while the virus remains in your body, its activity is significantly reduced, leading to fewer and less severe outbreaks. These medications can help reduce both the frequency and severity of outbreaks. For many people, this can mean the difference between frequent, painful episodes and a more manageable condition. It's also worth noting that these medications can be taken either episodically, at the onset of symptoms, or daily as a suppressive therapy to prevent outbreaks from occurring in the first place. They can also lower the risk of transmitting the virus to your partners. This is particularly important for those in intimate relationships, as it helps protect the health of loved ones. Open and honest communication with your partner about your condition and the steps you're taking to manage it is crucial. Condoms play a crucial role in preventing the spread of herpes. While they are not 100% effective, they significantly reduce the risk of transmission by providing a barrier that limits skin-to-skin contact. It's important to use condoms consistently and correctly to maximize their protective benefits. It's important to note that even when no symptoms are present, transmission is still possible. This is known as asymptomatic shedding, where the virus is active on the skin without causing any visible signs. This is why taking antiviral medications and using condoms are both essential strategies in reducing the risk of spreading the virus. This is why open communication with your partners is vital. Discussing your condition openly can help build trust and ensure that both you and your partner are taking the necessary precautions. It's also a good idea to have regular checkups with your healthcare provider to monitor your condition and adjust your treatment plan as needed. It allows everyone to make informed decisions about their sexual health and, ultimately, reduces the risk of transmission. By staying informed, taking your medications as prescribed, using protection, and maintaining open lines of communication, you can manage genital herpes effectively and lead a healthy, fulfilling life. Remember, you're not alone, and with the right support and resources, you can navigate this condition with confidence. Living with genital herpes can be emotionally challenging. It's important to remember that you are not alone. Millions of people are living with herpes. Managing stress, getting enough sleep, and eating a healthy diet can help. These practices can boost the immune system. They can also reduce the frequency of outbreaks. It's crucial to prioritize self-care. Engaging in activities that bring joy and relaxation is beneficial. Stigma surrounding STIs can be a barrier to seeking help. It's important to remember that herpes is a common infection. It doesn't define a person's worth. Talking to a healthcare provider is the first step. They can provide accurate information about the virus. They can also offer guidance on management and prevention. Support groups and online resources are available. These platforms offer a safe space to connect with others. Sharing experiences can be empowering and reduce feelings of isolation. Open communication with partners about sexual health is crucial. It fosters trust and respect. It also allows both partners to make informed decisions. Disclosing a herpes diagnosis can be difficult. However, honesty is essential for maintaining a healthy relationship. When discussing herpes, use a calm and compassionate approach. Focus on the facts and emphasize that herpes is manageable. Receiving a genital herpes diagnosis can be overwhelming. It's important to remember that herpes is a manageable condition. With proper care and support, people with herpes can live healthy and fulfilling lives. By prioritizing open communication, seeking accurate information, and practicing safe sex, we can reduce the impact of genital herpes. We can also create a more understanding and supportive environment for those living with the virus.